There we go. Hello, everybody. Welcome to my Lunch and Learn series. And I think most of you know me by now. I'm Helen Panos, Dynamis Learning Academy, the owner, and we have a K through 12 tutoring service. We help children reach their potential. The way we do that is we listen to what a parent needs and match them up with the right type of tutor. We come into your home or a mutually convenient location like a library. We do not have a brick and mortar. I was saying this a lot yesterday. I was at a school and people are like, oh, that's a good idea. So people are used to a brick and mortar type of a building, and we do not have that. We come to you or near you. So I wanted to bring on one of my podcast guests today because she is, I think, becoming very busy, and her whole profession has become very busy lately. Dr. Coleman, thank you for coming to the show and taking time to do this.
Thank you for having me.
I know we try to have her on in July, and some things sometimes happen, and we had to reschedule it.
Yes, COVID decided to take over my world.
Oh no, I know. God, that was awful. So it seems to be taking over the world in a way, and good and bad ways, actually. Yes. So we're going to talk today about psychoevaluations and when is a good time to get one, and when you what are the flags, I think I would say, that maybe identifies to a parent when they're thinking, oh, this is not just an academic issue. This might be, or this is not just, I don't know, just a small minor thing that a child will get over. I hear that a lot. Parents think that things are going to just kind of go away possibly.
Yeah.
And that's not necessarily the case in a lot of things going on today. But there are times when children... Well, first of all, I want you to introduce yourself, Dr. Coleman. What's your background?
Yes.
Let me start there.
Yes. So I am a licensed psychologist. I've been in the mental health field for 15 years now. I've been in private practice now for the past 8 years. And I am in private practice. The Georgia Autism Center is where you can find me on any given day of the week. And in my role as a psychologist, I assess and diagnose ADHD, autism, specific learning differences, and also any secondary anxiety that may come along with those particular conditions. And in addition to my assessment work, I do a lot of parent support and guidance around connecting them with resources, helping them locate resources, and then also any type of financial supports for children that I see who have developmental differences.
Oh, and I want to thank you for speaking to one of our parents, and she had something very nice to say about you. So I'll post that later today and tag you.
Yes, absolutely. Absolutely. I don't mind at all, because there's so many resources out there that many parents are not aware of. And so I try to do my best to provide them with those supports so that they can get the most out of the things that are out there for their children and their families.
Mm-hmm. So let's start with, there are times when children may have trouble in school. You hear from say you get the call from the parent, from the teacher, or you get an email from the teacher, and they say, Joey is like, I don't know, getting up, doing this, doing that, or not focusing, not turning in work. So when does it get to a point when a parent or a caregiver should seek out an evaluation for their child? What are the flags?
Yes. So there are 3 questions that I always tell parents and caregivers to ask themselves. The number one question is this a newer concern, or is this something that you have been worried about for a while? Have you been getting consistent reports from teachers? Have teachers from year to year been sharing the same concerns with you in their observations in the classroom? So that's number one. If you have had concerns and you're like, okay, first grade, all right, second grade, this is still happening, third grade, it's like, okay, at that point, it will probably be a great idea to seek out an educational assessment for sure. I also tell parents, how are what you're seeing, is it affecting school? Is it causing more difficulty when it comes to learning, when it comes to being able to grasp the information? Are grades affected? So that's another telltale sign that, okay, I probably need to further explore what may be going on with my child Is this a learning challenge? Is this something related to attention? Is it anxiety related? And from there, you've got the options as far as you go, as far as how you go about doing that, whether it's requesting an educational evaluation through the school setting, and also getting it done privately as well.
Mm-hmm.
Mm-hmm.
So let's say somebody has a psychological.
Mm-hmm.
Maybe it's 2 years old or 3,
Mm-hmm.
maybe before COVID, let's say.
Mm-hmm.
If they're seeing newer things or things have rapidly declined, let's say, do you suggest they go back and update and do another?
Absolutely. Absolutely. My typical guideline around educational assessments is to reassess every 2 to 3 years, not unless there are newer concerns, then it should happen before that time frame. Because one thing about children, they are very dynamic. They are going through various stages of development, and things change from year to year and as they are getting older. And so getting updates as far as their functioning is really helpful, because we don't want to use outdated information to support them currently, because it may not be consistent with what they're needing in the moment.
Mm-hmm. And would a psychological, let's say a parent does a psychological, and let's say the diagnosis is ADHD, executive functioning,
Mm-hmm.
but then the parent continues to see some behaviors, it is affecting grades or tests or things like that, what would be the next thing you suggest that a parent do?
In
Possibly.
a situation like that, there probably is something else going on besides just the ADHD and executive functioning challenges. Behaviors, especially those that look more like opposition defiance, typically stem from other things. It could be anxiety related. It could be task avoidance because of, finding that, the work is harder, or they have a harder time with regulating themselves. So in those situations, I would suggest that a parent actually reach out to look into two different things. Child therapy for their child, so that there can be some support around behavior management, figuring out like what's contributing to the behaviors, and then also parents participating in sessions as well with a therapist to get support and learn some more effective disciplinary strategies that may be more helpful based on their child's specific needs. So I think at that point, we've got to take it beyond the school setting and beyond the tutoring environment, and really focus on therapeutic intervention within a private setting.
And is that then a psychiatrist, or is that?
It can be a licensed professional counselor, a licensed psychologist, a registered play therapist, so a licensed clinical social worker, but you want to work with a therapist. And then if the challenges continue and there's not a lot of progress, then at that point, the therapist may talk to the family about talking to a child psychiatrist in regards to if medication is something that needs to be looked into, or other alternatives, alternative forms of treatment too, things like neurofeedback as well.
Okay. Great. I know anxiety has been a big thing, and that's why I've kind of asked all these questions, because I'm finding, and even while we're tutoring, I'm seeing some different things popping up. The things that teachers have been saying that they see, actually, they'll say things like, gosh, this was a very difficult year, or the children seem, quote, needy, or these are not my words, this is teachers talking. I know a lot of teachers.
Yeah.
And behavior is up on the rise. I think, gosh, I just saw a school system where they had to, I think it was up in Rome, Georgia, where they had to, I don't know, suspend or do something with a bunch of students that were volume of behavior going on.
Yes.
And so anxiety has become more pronounced for children as it relates to schoolwork. And we know there's a lot of pressure being put on the schools even more now to get just back to things, right, as they were. And we all know there was a little gap here the last 2 years, right? So
for sure.
And then a child can be evaluated to confirm this, right? So
yes, absolutely. Anxiety, I do my fair share of anxiety assessments within my educational assessments, because I do see many children who have secondary anxiety that is related to their learning differences, whether it's the ADHD, a specific learning disability, or even autism spectrum disorder. And so I work with the parents and kind of pinpointing like what are they seeing, and then I also, if the child is able to verbalize, have conversations about what they are directly experiencing, and also involve the teacher as well in any observations they're seeing in the classroom. And I tell parents all the time, if you're having to do a lot of reassurance with your child, if there's a lot of preparation needed, school refusal, avoidance when it comes to classwork or other situations, whether it's social related, going out in public places, lots more irritability, crying, and not really knowing what's happening with your child, not being able to pinpoint a specific trigger. These are all signs to me that, okay, your child may be experiencing emotional distress. There may be changes in sleep patterns, where your child is having a harder time falling asleep or waking up frequently during the night, or not even wanting to separate to be able to go to sleep independently. So these are some of the things that I've seen in my clinical work, along with the self-pressure and the self-criticism and the need to be perfect. Those have really, really skyrocketed in the past couple of years, between virtual learning, the pandemic, having to go back and forth between in-person, remote learning. It has really caused a lot of children to have this strong need to want to do so well, and it's turned into an unhealthy way of wanting to be successful and do well in school.
Yeah, I'm seeing that too. I'm glad you brought that up, because in tutoring, I was somewhere last Monday, and the child was debating me on the verbiage. He used the word saw. I said, it's actually when you look out the window, and he says to me, it's past tense. I said, yes, saw is past tense, but you're using the wrong. And he started to actually, because he's so intelligent. Okay, he's like on a second grade level, but he's reading on a fifth grade level. Wow. Very intelligent. So the need, again, because I had to point out that this wasn't correct, it was like this need about not being correct. He was upset about it and started tearing up, actually. So I'm seeing that.
The corrective feedback can definitely be very difficult for children with anxiety to digest. I see it when I'm doing clinical assessments. Some of the assessments that we do require us to give feedback in the moment, which is part of that is to help them and make sure that they're understanding the task. And so when you're having to do that more than just one or two times with a child in the clinical assessment process, it can really boost up the frustration, the shutting down, not wanting to move forward. And then I'm having to get parents involved to support me in reassuring and encouraging their child that, you're doing great. It's not expected for you to get every single thing correct. This is so I can learn more about your learning style, your strengths versus areas that you need more support in. So it's okay. And so I see the constant reassurance in my clinical work during the actual assessment process when I'm doing testing.
Yeah, it's definitely some trying times going on right now. And I really feel for parents, because we talk about these things during tutoring. It comes up in academics.
Right. And then they start developing anxiety, and they're stressed and overwhelmed and don't know what to do with their own stress and anxiety.
Yep. And I put your information down below as far as an email while we're talking about this, so people can see that scrolling down below.
Yes. Definitely feel free to reach out if you have questions or need to consult.
Yeah, and I wanted to make it clear to parents too that you're not just doing autism, that you do any type of psychological evaluation.
Yes. So yes, it does not have to be autism. ADHD, dyslexia, dysgraphia, nonverbal learning differences, dyscalculia, and anxiety for sure. Definitely feel free to reach out if you have concerns in any of those areas, or question whether or not you need to get an assessment done for your child, and we can talk and I can help you figure out whether or not it's something that you should move forward with.
Okay. And then one more question. After a child's been diagnosed, let's say, with a disorder of any type, such as ADHD or a learning disability, there's a lot. There's OCD, there's ODD. There's a lot of acronyms out there. What recommendations do you make to a family as a first priority? I think that's probably the biggest thing, is parents are like, well, what do I do?
Yes, it's like, what do I do next? I have this information. What do I do with it? So, number one thing, priority, first step after getting your child's written evaluation is to schedule a feedback session. I cannot stress that enough. The feedback session allows for you to be able to ask questions about your child's written report, get clarification about any aspect of the report, and be able to talk about the recommendations, where you can locate the particular resources that are recommended, and come up with a solid game plan. Without that game plan, a lot of parents end up being lost and not knowing where to begin. And so, in order to not feel so confused and lost in the process, schedule that follow up appointment. The feedback session is number one priority. Once you have done that, next step is educating yourself, becoming informed about your child's diagnosis. What does it mean for your child? What could potentially be things that it can look like, at this level of development versus, another level of development? How can it potentially play out in the classroom, at home? What are things that you can do at home outside of seeing a therapist or using medication within your family system? Also, having a conversation with your child. If your child is old enough to be able to have that conversation and is, pretty well versed when it comes to vocabulary and language development, have a conversation with your child about their diagnosis. This can be one of the most helpful things for a child, for them to now understand, wow, now I know why it's much harder for me to focus. Oh, or now I know why, it's taking longer for me to understand what I've just read, or to be able to do those math problems, or to be able to write that essay. Because for kids, it's like they feel it's a part of their identity, being able to perform a certain way in school, and to be able to, be compared to their other peers in their classes and things like that. They want to know that they are doing well, and it affects their confidence. And so knowing that there's a reason, there's a name to what they've been dealing with is helpful, and helps come up with like a sense of relief for them, that they now know. And so using terms that they understand when you're having those conversations. You can even bring in the psychologist who diagnosed your child and have their support in having that conversation with your child about their diagnosis and what it means, and allowing them the opportunity to ask questions. That's really important. And so once you've done all of that, next thing is putting that plan in place. So if that psychologist has talked about, seeing an ADHD or an executive functioning coach, or seeing, a tutor like yourself, Helen, or working with a play therapist, or whoever the case is, then you want to start putting those things in place, locating, contacting through phone, email, the particular places that the psychologist has recommended, and move forward with that plan.
So what I see as an educator, if I may say, is I think where parents get stumped is the first thing they think is it's a teacher's fault. They're missing what's happening, or the school's fault. Right. And it could be, I'm not saying it's not, but these are the things I see. And then they think that the child doesn't understand the material, but they may, because they're actually very intelligent. And I don't think parents see the connection of a disorder and where a child cannot help themselves.
Yes.
Versus they're either purposely not doing it, or they just, the diagnosis, which they may not have yet, is affecting their academics. And they think the child may be doing it on purpose, or they're not studying, or they're not working hard enough. I've heard all of those things.
Yes. Lazy is a big word that I hear to describe kids that I see.
They're lazy. That's right. Yes. So, but where I think a parent they don't tend to look at, maybe there is a disorder, or maybe there's something the child can't help himself with.
Exactly.
Right? And then adults do this automatically. We automatically blame the child that they're up to something, right? And they may not be.
No. When a child is verbalizing that something is hard for them, I think it's important for parents and caregivers to listen to that. If a child is avoiding work, if they're having meltdowns in response to work, if there's tantrums in response to work, if there's just outright refusal and defiance in response to work, there's typically a reason for that, and it needs to be further explored because something's going on related to that schoolwork that's stressing that child.
Right.
Yeah.
I think the underlying thing is what parents miss, but what they're saying is the thing that's visible, right?
Right, which is the
The
behavior.
schoolwork,
Yes.
what the teacher's seeing,
Mhm.
oh,
Yes.
he's fidgeting or he's
Right.
doing this.
Getting
Yeah.
up out of his seat, he's running out of the class, he's under the desk,
Yeah.
she's talking to her peers when she's not supposed to, she's zoning out, she's doodling, she's crying, he's falling asleep. There's usually a reason for those things.
Yeah. Right.
Mhm.
So parents need to look further
Right.
and at school, I guess they could reach out first to the counselor,
Yes.
start
Mhm.
there, and
And I
a
tell parents to make,
psychologist.
yes, you want to make a written request to your child's school if you're wanting the school to do an evaluation and start any process related to possible eligibility for a 504 plan or an individualized education program. So you want to reach out to the school to see who that contact person is and make a written request, whether that's through certified mail, whether that's email, or whether that's dropping off a letter in person to your child's school, and then following up within 5 to 7 days if you haven't heard back from anyone, and then go from there. Make sure you give written consent and permission for the school to move forward with the process. Attend those meetings to be able to share your concerns that you specifically have about your child, and try to be as collaborative as possible in the process and as involved in the process. Make sure you're communicating consistently with your child's teachers. You want to know what your child's teachers are seeing in the classroom. Where are they strong? Where are they having more difficulty? Are they performing on grade level? All of those things are important. And if you're not consistently communicating with your child's teachers, it's going to make it much more difficult for you to really understand whether or not your child's behaviors that look like defiance are because of something more related to learning.
And I want to mention to parents to make sure you are doing a 504 meeting, especially those of you in private schools,
Absolutely.
because the smaller private schools tend to not have what I call a 504 chair, right?
Mm-hmm.
Typically, they're going to have a more difficult time trying to probably give you that meeting. But I think you need to stay on top of it. Somebody there should definitely do it because your child might need to be sitting in the front of the room as an accommodation. They may need extended time.
Right.
And if you're coming from a public school into a private, and the private school hasn't updated that 504 in a year or two because of COVID or whatever was going on, now's the time to call a meeting, folks.
Absolutely. You need to get those documents updated because I'm pretty sure your child's development and functioning has changed in 2 years. And it's important to have the most accurate and updated information in order to make sure that the supports that your child is getting make sense for what they're dealing with right now. We don't want to use old recommendations that may not be related to what your child is dealing with right now.
I agree.
Because you may not see any progress with those.
Correct. Well, I tell you what, your timing was perfect. I'm sorry you had COVID back then, but I think this is actually an even better time for you to have come on once school started.
Yes.
And parents are now in the midst of probably maybe starting to see these things.
Yes.
So
absolutely.
I appreciate you so much, Dr. Coleman.
You're welcome.
Awesome.
You're welcome, Helen. Thank you for having me.
Oh, you're welcome. And this, folks, the replay, if you didn't catch the live, the replay will be scrolling. Please reach out to Dr. Coleman or myself. I have experience in 504 plans, so I can talk to you about that. Dr. Coleman can do a psychoeducational evaluation for you all. She can even do a quick free conversation, correct? Right, Dr. Coleman?
Absolutely.
So I would definitely reach out to her if you're seeing any problems at all. Well, thank you very much, Dr. Coleman. And I'm just going to end this and we'll talk in a minute. Thank you.
All right.
Bye, everybody. Have a good rest of your week.